This was, as I mentioned, randomized 1:1 to receive ipilimumab 3 mg per kg up to 4 times to get nivolumab. At the time, the standard dosing was 3 mg per kg every 2 weeks, or nivolumab 1 milligram per kilogram plus ipilimumab 3 milligrams per kilogram every 3 weeks for up to 4 doses, followed by the same nivolumab maintenance. Patients were enrolled if they had locally advanced unresectable or metastatic melanoma of basically any kind other than uveal melanoma. So in this case, the mucosal, acral, kind of less common melanoma subtypes were kind of lumped into the trial, along with the vast majority of them being, of course, cutaneous melanomas arising from hair-bearing surfaces. And so the trial was powered to detect a PFS and OS difference between nivolumab and ipilimumab, and the combination of nivolumab ipilimumab against ipilimumab. So unfortunately, the million-dollar question of what we want to know now, which is nivolumab versus nivolumab plus ipilimumab, was not, it's just an exploratory endpoint for this trial. And certainly this type of analysis, looking at specifically the subset of patients with mucosal melanoma, that's an exploratory subset analysis as well, because it fills a clinical need that many of us have when we have a patient in front of us with an advanced melanoma that's not your garden variety sun-exposed cutaneous melanoma.